Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Mwaka. First, the highlights. NCDC says misinformation and conspiracy theories around COVID-19 are driving new infections in the country. Southeast and South-South states reactivate COVID-19 preparedness and response mechanisms. And following outbreak in China, concerns heighten about COVID-19 spread to other parts of the country. Now, according to the Nigeria Center for Disease Control, NCDC, 216 people tested positive for the virus on Sunday. The latest positive samples of COVID-19 were recorded in 8 states, which also includes data from Akwa Ibom State for previous days of July 24th and July 25th. Let's take a look at the report.
The latest update coming from the Nigeria Center for Disease Control shows that 216 positive COVID-19 infections have been confirmed from 8 states within the last 24 hours, indicating a decline from the 272 cases recorded a day earlier. Lagos reported the highest figure from the latest tally with 108 cases, followed closely by Akwa Ibom with 96 cases. The update also includes data from Akwa Ibom for July 24th and 25th. Oyo reported 4 cases, Rivers had 3, while Edo State recorded 2 cases. Ekiti, Kano and Osun states reported 1 case each. According to the agency, 0 cases were reported from the FCT, Imo, Kaduna, Ogun, Plateau and Sokoto states. Nigeria now has a total of 171,111 confirmed cases. 1 additional recovery was recorded in the last 24 hours, raising the total number of discharged cases to 164,789. There were no deaths resulting from COVID-19 complications, leaving the fatality toll at 2,132. Presently, there are over 4,000 active cases in the country, while over 2.4 million samples have been tested so far. In Africa, there are over 6.4 million confirmed cases, more than 164,000 deaths on the continent. Globally, more than 194 million COVID-19 cases have been confirmed, while deaths have surpassed 4.1 million.
In the last 17 months, countries across the world have been affected by the impact of the COVID-19 pandemic. In Nigeria, there have been other disease outbreaks in addition to the COVID-19, including Lassa fever and cholera. In line with that, the Nigeria Center for Disease Control, NCDC, in collaboration with partners, is hosting the maiden edition of the Nigerian Conference of Applied and Field Epidemiology, NICAFE, this week, with the theme Building Back Better, COVID-19 and Other Disease Outbreaks. At the session today, the NCDC says misinformation and conspiracy theories around the virus are drivers of new infections across the country. As such, information on the social media shape many people's behavioral patterns regarding the non-pharmaceutical interventions.
The COVID-19 outbreak has been very disruptive, but it has also provided us a lot of opportunities to build back stronger on some of the systems we already had in place even before the COVID came. For instance, we've always used an incident management system in responding to disease outbreaks. This time around with COVID, we had a lot of stakeholder engagement, a lot of partners, multi-sectoral kind of response coming together, and we were able to test this system. Now we had the laboratory aspect of our response strengthened as a result of this outbreak. We are strengthening all the things that we have been doing because actually the strategy has not changed. It's still these non-pharmaceutical interventions, public health and social measures that can keep any nation safe. And we keep providing information, generating evidence and providing information on how best to keep this virus, away from us and to make sure that we are safe from it. Misinformation is a clear challenge to the outbreak, and all these conspiracy theories and all forms of misinformation that you see all over the place that is impacting on how people respond to them. So all the behavioral factors that you see that is driving the response, the outbreak currently, like people not wearing their face mask, people not avoiding large gatherings, is as a result of misinformation.
Still staying with infectious diseases, since September 2017, Nigeria has continued to report sporadic cases of monkeypox. According to the National Technical Working Group for Monkeypox with the NCDC, from September 2017 to June 2021, a total of 466 suspected monkeypox cases were reported in 30 states. Of the reported cases, 205, that is 43.9%, have been confirmed in 18 states, with Rivers the highest, 50 cases, and of course Ebonyi 1 case. And look at all of the other states and the amount recorded there. A total of 8 deaths have also been recorded. Case fatality ratio of monkeypox about 3.9%. And that's just in 6 states. Now, in 2021, a total of 52 suspected cases have been reported between January and June. Now, of those cases, 13 were confirmed from 5 states, including Delta, Bayelsa, 4 in Lagos, 1 in Edo, 1 in Rivers, and no death, or rather 3 in Rivers and no death. But does the resurgence of monkeypox complicate the coronavirus situation? Joining us to take a closer look at this is a virologist, Dr. Akiala Ishaku, and he's joining us from Abuja. Thank you for joining us on the program.
Thank you, Melissa, for having me.
All right. First, explain to us this disease called monkeypox.
Actually, monkeypox is a viral disease, basically of wild monkeys. It is a disease of animals, but it can be transmitted to humans, and that's what we call zoonotic diseases. Once humans have encounter with domestic animals or wild animals like squirrels, like monkeys, or have encounter with their infectious excretion, such as their saliva and urine, they get transmitted to humans. And humans, in turn, can also transmit it to other humans. And so there is a transmission between animal to humans and also human to human transmission. It is actually a neglected tropical disease. The first time we had the outbreak, it was in 2017, about 39 years ago. So it is re-emerging again. And so that posed a kind of a clear danger. And I hope you know that a traveler from Nigeria was picked in the United States of America, and then it was isolated. The patient was isolated, and then it was discovered that it was monkeypox. So it is actually, it can become severe in people that are immunosuppressed, and also it can be severe in clusters that are quite endemic and have more contacts with the monkeys or the animals. So it is a neglected tropical disease. I'm quite sure that the concept of One Health that we are talking about needs to bring to bear. So we need to create an ecosystem where we can understand disease dynamics from the animal, environmental, and human point of view, and bring it into an ecosystem where we also understand the dynamics.
And that's
so
also, Dr. Ishaku, if I may. Yes, if I may, I mean, you've spoken about One Health. You've also spoken about that index case in Dallas. But then the case is said to have traveled from Nigeria. And we have, I believe, structures to monitor and identify a lot of this infectious diseases. So how is it that it escaped our shores, it escaped our radar here in Nigeria? Oh dear, I think we might have lost okay, go ahead, please.
Yeah, you know that international travels. You know that international travels are drivers for a lot of infectious diseases. So monkeypox virus is an emerging virus. The diagnostic tool panels are not readily available, and we don't commonly test them for international travelers. So the chances that the patients that travel from Nigeria to Dallas might have had an encounter with the virus in Nigeria is there, because it is not part of our test panel that these are diseases that we need to test before an individual travel outside the country. But this also brings to bear that we need to activate active surveillance of our port authority. We need to strengthen surveillance in our health port authority so that we can be able to see to how we can cascade and be able to identify most of these diseases, neglected tropical diseases that are emerging. Time is coming that we need a global public health passport, because we are coming to that when you hear about COVID-19 passport. Time is coming that people will be discussing about global health passport for international travelers to be able to undergo certain array of tests. I hope normally said we just have outbreak of yellow fever, which is quite long ago. We have not experienced it, and now we are having monkeypox. So we are having epidemics in a pandemic in Nigeria, and it calls for us to strengthen our healthcare system.
Indeed, a lot of high surveillance for all of this. Well, appreciate your time. Thank you so much, virologist Dr. Akiala Ishaku. Thank you so much for joining us on the program.
Thank you for having me.
Let's go over to Enugu State, where the government has inaugurated an 11-man project steering committee of the Nigeria COVID-19 Preparedness and Response Project to facilitate and enhance capacity in the state. The responsibilities of the committee will include the review and approval of the state's incident action plan, to oversee the implementation of the project at the state level, onward transmission to the coordinating unit, amongst others. According to the Secretary to the State Government, Professor Uche Otwanya, the state government will continue in its effort to contain the spread of COVID-19 in the state, as well as the cholera outbreak.
COREC, therefore, will enhance the institutional and operational capacity for disease detection through provision of technical expertise, coordination, support, as well as detection and diagnosis, but more importantly, case management efforts in all forms or in all states of the country and FCT. The responsibilities of the committee include the following. 1. Oversee project implementation at state level. 2. Review and approve the state's incident action plan, IAPA, for onward transmission to the Project Coordinating Unit, PCU. 3. Review progress reports to ensure timely implementation of the project. 4. Oversee the State Coordinating Unit, SCU, to ensure timely implementation of the project. And 5. Ensure that financing from Nigeria corporate complements financing from other sources and are efficiently utilized.
Over in Akwa Ibom State, the government is reactivating all the COVID-19 monitoring mechanisms to ensure strict compliance with the COVID-19 guidelines and protocols to check the spread of the Delta variant. It has also called on residents to be cautious and vigilant to avoid contracting it. Now, the Secretary to the State Government and Chairman of the COVID-19 Management Committee in the state, Dr. Emmanuel Ekwem, made the appeal in the state capital, Uyo.
Over the past 2 weeks, cases of COVID-19 within the state have risen from 5 to 156. Repeat, from 5 to 156 only in the past 2 weeks. This increase, when considered in the light of the new Delta variant of the virus, which has now been isolated in Nigeria, calls for a renewal of a collective effort at preventing the spread of COVID-19 virus infection in our state. Accordingly, the government calls on all citizens of the state to obey all COVID-19 guidelines and protocols earlier enunciated by the government of the state and the Nigerian Center for Disease Control, NCDC. And these measures include: 1, that you use your face mask and use it properly, ensuring that both the mouth and the nose are properly covered. 2, wash your hands regularly with soap and in clean running water.
Still ahead, outside Nigeria's shores, South Africa eases COVID restriction. It also adds 18 to 34-year-olds to the age range for vaccination. That's in a moment. Welcome back. South Africa has eased some COVID restrictions after President Cyril Ramaphosa said the country had largely passed the peak of its third wave of the pandemic. Speaking to the nation on Sunday night, President Cyril Ramaphosa cautioned the people to continue to be safety conscious as the virus remains very present. With more than 6.3 million people vaccinated, South Africa has inoculated over 10% of its population so far, and 18 to 34-year-olds have been added to the age range for vaccination.
The latest figures suggest that we have largely passed the peak of the third wave of infections, although there are areas in the country where we still need to be concerned because the rates of infections have not yet shown signs of decline. The measures we put in place for the past 28 days, alongside the continued adherence of South Africans to basic health precautions, have been effective in reducing the rate of infection. However, as we have observed before, there are significant differences between provinces. As infections in Gauteng fall, daily new infections in the Western Cape, in the Eastern Cape and KwaZulu-Natal continue to be on the rise. There has also been a concerning rise of infections in the Northern Cape after a period of relative stability. In all these cases, infections are being driven by the Delta variant, which, as we said before, is far more transmissible than previous variants. Now, more than ever, we need to adhere to the basic precautions so that we can limit the spread of the virus from one person to another. The overall decline in new infections means that it is possible to gradually ease some of the restrictions on gatherings, movement, and the sale of alcohol.
South Africa's President Cyril Ramaphosa. Let's go over to Australia. Its COVID-19 strategy has been put under strain. Sydney, a city of 5 million, is now recording just over 100 new infections a day. But Australia's previously low rates, it's no joke. And it appears that the Delta variant combined with low vaccination rate is causing trouble. Joining us right now, Dr. Oluwadamilola Obawede, medical doctor, also postgraduate researcher in Monash University. She joins us via Zoom. Thanks for joining us on the program.
Thanks for having me.
All right. What exactly is responsible for the sudden rise in cases in Australia?
Well, I believe that the main factor for this current outbreak is the COVID-19 variant, that is the Delta variant. We all know that the Delta variant is much more infectious than previous strains. So some of the early cases in this outbreak, they basically occurred from merely brief exposures and contacts. So some of the early transmissions also happened in places where health authorities couldn't be confident that they could track down all the casual contacts. Also, those who were exposed may have also underestimated their risk of being infected. So although it's true, almost all the cases were linked to previous known cases. Some were actually linked via a very convoluted, longer path, So this just means that over some days, more people were circulating while infectious. Lastly, Australia has really depended on contact tracing, but the potential risk of contact tracing is that things can quickly escalate if you actually miss a major chain of infection. And I think this was the case in one of the clusters in Sydney. So at the end of the day, I still feel it just really boils down to the transmissibility of Delta variant.
So essentially, have there been more restrictions put in place, and do they apply across states? Because we understand that some people are saying, some critics are actually talking about the fact that some states didn't enforce the stay-at-home orders, and that affected their states recording cases of the Delta variant.
Yeah, well, I mean, throughout this pandemic, all the states have basically been working independently, like regarding restrictions. For example, in Victoria, we are currently on lockdown. This is our 5th lockdown. And this just means that you can't leave your house for except for one of 5 reasons, which are shopping for necessary goods, I think care and giving care and receiving care, exercising for within 5-kilometer radius from your house, also authorized work, and to get a COVID vaccine. Also, now our border has been shut to other states like New South Wales, which is now an extreme risk zone. But in Sydney, so now Sydney has a stay-at-home policy, but in Sydney you can only leave your house for similar reasons like Victoria. But the thing is, I think with Sydney, when their cases started, they actually did not really enforce their stay-at-home policy. It was more like an advice to stay at home. But now they are trying to be a bit strict about it. So overall, I think the restrictions across the states, which have growing cases, are quite similar. They just have few tweaks here and there.
So what do you think about the anti-lockdown protests in Sydney? And perhaps as a final question, what role is vaccination playing in all of this?
Okay, so first for the protests, of course, I understand how staying at home or how being stuck at home is. I know how frustrating it can be, especially for small business owners. But I do not think having anti-lockdown protests is the answer, considering now what we are dealing with is the Delta variant, which, like we said, it's very transmissible. So having such close contact in crowded areas, for me, is just clearly unsafe and, yeah, pretty not good. But honestly, I just really hope that this protest doesn't slow down the progress that has been made by the lockdown. And about the vaccine rollout, to be honest, I think it's been going really slowly. But for now, it's kind of picking up because in Sydney, for example, with their outbreak, they've advised everyone to get vaccinated, whether with AstraZeneca or Pfizer. While waiting for Pfizer vaccines to come in, it's okay, if you can just get vaccinated with AstraZeneca, just do so. So I think that it's going to pick up soon, but it's still pretty slow.
All right, we appreciate your time. Thanks a lot and stay safe. Dr. Oluwadamilolo Bawade is a medical doctor, postgraduate researcher at Monash University, Australia. Thanks again.
Thank you.
Concerns are rising over an outbreak of the coronavirus in China that began at an airport last week and which may have spread to other parts of the country. A number of airport workers last week had tested positive at Nanjing Lukou International Airport, prompting flight cancellations and delays. Let's take a look at the global update.
Global Updates continues in Thailand, where thousands of people from high-risk groups have been queuing to be vaccinated at Bangkok's Bang Sue Grand Station during an inoculation drive that comes amid vaccine shortages in the country. People over the age of 60, pregnant women, and those over 100 kilograms are among people considered to be in high-risk groups. Elderly people have been prioritized for vaccination since July the 12th, although the priority window is set to close on Saturday, July the 31st.
The biggest risk to the world at the moment is simply Delta.
The head of Britain's coronavirus genome sequencing effort says the Delta variant is the fastest, fittest and most formidable version of the coronavirus that causes COVID-19 the world has encountered. The major worry about the Delta variant, first identified in India, is not that it makes people sicker, but that it spreads far more easily from person to person, increasing infections and hospitalizations among the unvaccinated. Delta has also been shown to reduce the effectiveness of the first dose of COVID-19 vaccines, though 2 shots still provide high protection from severe disease. Indonesia has started a week's extension of COVID-19 curbs day, with some residents expressing irritation at the continued restrictions and the way they are being implemented. The measures are being extended as cases of the Delta variant of the virus continue to surge. In the capital, Jakarta, roadblocks were in place with officers inspecting paperwork to ensure that only essential workers were traveling. This is causing frustration for workers who cannot acquire the correct papers, including 40-year-old finance service employee Susanto. Finally, France's parliament has approved a bill which will make COVID-19 vaccinations compulsory for health workers, as well as require a health pass in a wide array for social venues as the country battles with a fourth wave of coronavirus infections. Thousands took to the streets in Paris to protest the implementation of the COVID-19 health pass while it was still being debated in the Senate on Saturday for the second weekend in a row. Visitors heading to museums, cinemas or swimming pools in France are already denied entry if they cannot produce a pass showing that they've been vaccinated against COVID-19 or have had a recent negative test. The pass has been required for large-scale festivals or to go clubbing.
Stay safe. Continue to take responsibility. You can visit our website. It's channelstv.com for more updates. You have breaking news, several other stories at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.